Last week in New South Wales, a record 738,000 people got vaccinated. An outstanding result, and I want to thank everybody for coming forward to do that. We're up to 5.9 million jabs in New South Wales. I'd set a target of 6 million by the end of the month, and it looks like we'll be at least a week ahead of schedule. So I'm so pleased that everybody's really heard the call, heard the messages, and is coming out to getting vaccinated. We had 160,000 people who got tested in the last 24 hours, another huge number. There were 818 cases of community transmission, with at least 42 of them infectious in the community. 3 people lost their lives overnight. We extend our deepest condolences. All 3 were in their 80s. All 3 had underlying conditions. It was 2 males and 1 female. Again, we extend our deepest sympathies, and Dr. Gale will provide further details of that. I also wanted to stress this morning that we're all going through the rollercoaster ride of emotions as case numbers go up and down, and I don't want us to focus so much on the case numbers going up and down. Absolutely we want to see the case numbers go down, no doubt about that, and we're working so hard together to make that possible. But the number we really need to focus on is the vaccination rate. Once we hit 70% double dose, we'll be able to live life more freely, and once we get to 80% double dose, essentially would have normalised the way that we treat COVID. As the Doherty report says, once you get to 70% double dose vaccinations, you start to transition and treat COVID as you would the flu in terms of how you record hospitalisations and how you record the way the community is going. And I really want to stress that point. In relation to the 6 million jabs and schools going back, I said that we'd have more to say about that towards the end of this week, and we will. We'll be able to communicate what additional freedom people might have once they get to full vaccination during September, and we'll also outline our plan for schools. And please know both are a work in progress, and we're consulting the Chief Psychiatrist as well as our public health team to make sure we get the right balance. In relation to the suburbs of concern in Greater Western Sydney and South Western Sydney remain the highest generator of the cases, unfortunately. So Marylands, Guildford, Auburn, Greystanes, Greenacre, Bankstown, Blacktown and the surrounding suburbs are the ones of most concern. And in regional New South Wales, as the Deputy Premier will outline, Western New South Wales remains our concern, but there's also a few areas where there's sewage detection of the COVID virus, but yet no cases. So the Deputy Premier will speak about that as well. And I really want to do a call out again to anybody who's between the ages of 16 to 39 in those 12 local government areas of concern. Please come forward and get vaccinated. Just get onto newsouthwales.gov.au to book. And once you book, we expect people to get vaccinated in the same week. So you don't have to wait a long time. It could be within days, even a couple of days or the next day. So please make sure that if you're between 16 and 39, you come forward. You're being given priority for obvious reasons. We're deeply grateful for your understanding and your patience, but please come forward and get vaccinated. Hundreds of thousands in that age group have already booked, but we're keen to see many more in that category. I'm also very pleased to have with us today one of the incredibly hard-working clinicians we have around New South Wales. Dr. Nguyen is here from Nepean Hospital, and she's going to speak about her experiences, but also focus on the importance of vaccination and getting the vaccination rate up. Now, I know what New South Wales is going through now is a difficult time, is a very challenging time, one which I hope none of us have to experience in our lifetimes again. But every state is going to have to go through the transition of going back to normality. And whilst our transition perhaps happened sooner and more starkly than what we had envisaged, every state, once you get to 80% double doses, every state's going to have to live with COVID. And you can't keep Delta out forever. You can't assume there'll be 0 cases, even if you've had 0 cases today. And so I really urge all of us to keep working together in New South Wales and across the nation to make sure we provide health and safety to all of our citizens as much as possible, but also we focus on what life looks like in just weeks and months away. And in fact, New South Wales is doing better than we anticipated in our vaccination rates. And I'm hoping to give updates to the community on when we'll hit the 70% double dose. At this stage, we're still saying the end of October, but there is a chance we'll get there sooner given how quickly people are responding. We're deeply grateful for that.